In 2013, the World Health Organization put together some guidelines to have alternative ways in which people can access and receive their drugs rather than just going to a pharmacy. Decentralized drug delivery mechanisms are one of those ways in which ARVs are delivered where they are needed in the easiest way possible.
Okay, Bonolo Meds program is a chronic medicines access program that is intended to improve accessibility to drugs by chronic, stable public patients. So we have established what we call a central dispensing unit, which is a sort of a drug warehousing, which is responsible for refilling these patients which are enrolled at health facilities. The central dispensing unit pre-packs these medicines as per prescriptions from health facilities, and then now they take these individual parcels to the selected pickup points, which are now our community collection points. In this case, we are using retail chemists. And also we have an innovation, we call it a semi-automated e-locker. We have one at Pioneer Mall, the other one is at Maseru Mall, Sankatana Health Center, St. Joseph's Hospital, and Baylor. That's where we have these e-lockers. Apart from then, we have 16 alternative pickup points, which I referred to earlier as retail chemists. So patients pick these parcels at a convenient time and location for them. It's highly accessible, very quick, very easy. They don't have to wait on long queues at health facilities. They don't have to miss their work. They just have to pick their medicines and go. They will only go to facilities when they are due for clinical reviews.
The government of Lesotho, through the Ministry of Health, with support from USAID, have shown commitment and leadership in the fight against HIV epidemic by incurring all the costs in relation to HIV, TB, and other healthcare services.
We are very excited to launch this program, the Bonolo Meds program. The Bonolo Meds program represents something unique, something innovative, and something that shows where we are going as an HIV program. As many of you know, the HIV/AIDS program in Lesotho is really at a watershed moment. We are at the point where we are saying we have 98% of people who know their status. They are already on treatment. People who are living with HIV are already on treatment, which means that most of the people and most of our services now have to go towards those kinds of services that keep people on treatment, that make it easy for people to stay on treatment. Because we know that treatment is not just prevention. Treatment means that people can stay without any sickness, and then they will not transmit the virus to their partners. We therefore are proud to be partnering with Bonolo Meds program in the launch of the decentralized service that includes private sector provision of ART, as well as access to chronic medication through automated dispensing machines. The Bonolo Meds program has already been proved to be successful in other countries, so it's worked well in countries such as South Africa, countries such as Zambia. And through such initiatives, USAID Lesotho looks forward to continuing working with the government of Lesotho in enhancing the provisions of quality and efficient services that enhance the lives of Lesotho.
So Bonolo Meds is going to be integrated. It is going to be easy to access antiretrovirals for stable patients who really do not have to be coming to the facility on a regular basis. And also other chronic patients like hypertensives and diabetes, and you can even access family planning commodities from this point. And also the Ministry of Health appreciates this and sees it as an opportune time for us to really embrace the Bonolo Meds, especially now when we are trying to decant our facilities in the interest of minimizing risks to infection amidst this COVID pandemic. Therefore, we are embracing this approach
And we really have started together with you. Remember where we started, including issues of MOUs, including issues of accessing this antiretrovirals, because the antiretrovirals that we are talking about here are the very same ones that people are accessing from our facilities. There is no additional supply that comes from Bonolo Med as a project, but they are still there. It's an arm to helping the Ministry of Health improve access and also achieve universal health coverage as a matter of policy at national and at global level. There are very numerous benefits about this, but you understand that the very first one is to improve retention under care. If you are not always worried about having to visit facilities every day, I think you become so comfortable, you will adhere to your medicines, but you will never lack any medicines. You will have no excuse not to be on treatment. Therefore, it improves access to care. We are already implementing what we call multi-month dispensing, and this meant people who used to come will dispense for 3 or 6 months. But this one now, it is further improved the coverage of this very well-proven intervention, which also improves access to medicines and also decongests our facilities and also improves.
This initiative will be running for 5 years. I am Modemade Lebamo reporting for the Post, Maseru.